To better understand and deploy workplace health and well-being initiatives, you really must understand the upstream socioeconomic factors that influence the health and well-being of the workforce. When you look at any of the determinants of health frameworks, actually healthcare is a less important contributor to the outcomes that matter to employers than these upstream determinants of behaviors and further upstream the socioeconomic factors. So in putting together workplace health initiatives, some of the most important socio-demographic factors that influence both health and productivity of the workforce include what you might expect, the income, but beyond income, the sense of financial security, which may not be directly associated with income, is tremendously influential. Levels of education, but then you look further about people's living conditions, basic living conditions, things like the housing security, food insecurity, transportation. All of those factors have a powerful influence on health, and we tend to underestimate the prevalence of those conditions in the workforce. There are a variety of ways. Most employers do some kind of workforce assessment of health. It's quite easy to add these factors of social determinants of health in those assessments. Not only easy to do, but important to do. As I mentioned, we tend to underestimate the prevalence of those factors in the workforce, and having it part of an ongoing assessment is an easy way to do it, or even in conversations between managers and employees is another effective way to gather this information. I think another factor important to employers in implementing these health initiatives is to take a step back and think even more broadly than the health of their workforce, to think broadly about the health and well-being of the workforce. While health is obviously important, it is only a factor in the broader construct of well-being that includes things like life evaluation, meaning and purpose in life, and positive affect. Those are not typically assessed when assessing health, but have powerful influence on the well-being of the workforce, and also factors that matter to employers about the not just the well-being of the workforce, but the productivity of the workforce as well. We implemented the health and well-being survey at Kaiser Permanente in support of our broad mission to improve the health and well-being of our members and our communities, and also in support of our belief that health is broader than just physical health, but includes mind, body, and spirit. So this was an attempt to measure in a meaningful way components of health and well-being that go beyond the traditional measures of physical health. And so we were interested in establishing a baseline for health and well-being of our members and our communities, to compare this baseline assessment with publicly available benchmarks, and importantly, looking at equity to look at issues about differences across race and ethnicity groups. Some of the learnings from our health and well-being assessment at Kaiser Permanente, first of all, are documented in a paper in the Permanente Journal on the socio-demographic determinants of health and well-being. But broadly, support the literature that financial issues and educational issues are powerfully influential in our population in terms of both health and well-being of the population. And the financial security goes beyond just levels of income, but how people are managing their finances and the stress created from it. Interestingly, in looking at the influence of income and education on well-being, when we look at it across race and ethnicity groups, of course we saw differences across race and ethnicity groups in health and well-being outcomes. But after stratifying by education and income, a lot of those differences across race and ethnicity go away.